Liver cancer is an oncological disease. Look at this picture, shows that liver cancer cells. CT findings. Look at this. And MRI findings. Detail going on. Introduction. Liver cancer, also known as hepatic cancer, is a malignant tumor that originates in the liver. It is one of the most common cancers globally, especially in regions where hepatitis B and C infections are prevalent. Liver cancer can either begin in liver, primary liver cancer, or spread from other organs to the liver, secondary or metastatic liver cancer. Early detection and treatment are crucial for improving outcomes. Definition. Liver cancer, also known as hepatocellular carcinoma, originates in the liver cells and can result from chronic liver diseases such as hepatitis or cirrhosis. Early detection and treatment are crucial for improving outcomes and often involve surgery, chemotherapy, or targeted therapy depending on the stage and health of the liver. Types. 1. Hepatocellular carcinoma, the most prevalent type, accounting for about 75% of all liver cancers. 2. Cholangiocarcinoma, a rare cancer that forms in the bile duct. It can be intrahepatic or inside the liver, or extrahepatic outside the liver. 3. Angiosarcoma and hemangiosarcoma, rare cancers that start in the blood vessels of the liver. 4. Hepatoblastoma, a rare form of liver cancer that typically affects children under the age of 5. 5. Secondary liver cancer, metastatic, cancer that originates elsewhere in the body and spread to the liver. Causes. Several factors contribute to the development of liver cancer, including 1. Chronic viral hepatitis B and C. Chronic infection with hepatitis B or C virus is the leading cause of liver cancer. 2. Cirrhosis, scarring of the liver due to chronic liver disease increases the risk. 3. Aflatoxin exposure, a toxin produced by mold on improperly stored crops such as grains and nuts, is a known carcinogen. 4. Alcoholism. Long-term heavy alcohol use can lead to liver damage and cirrhosis, increasing cancer risk. 5. Non-alcoholic fatty liver disease. Obesity related to fatty liver disease is an emerging cause of liver cancer. 6. Hemochromatosis, a genetic disorder that causes excess iron buildup in the liver, leading to cirrhosis and cancer. Risk factors. 1. Chronic hepatitis B or C infection. 2. Cirrhosis of liver. 3. Excessive alcohol consumption. 4. Exposure to aflatoxins. 5. Obesity and associated non-alcoholic fatty liver disease. 6. Type 2 diabetes. 7. Genetic disorders. Example, hemochromatosis, alpha 1 antitrypsin deficiency. 8. Male gender. Men are more likely to develop liver cancer than women. 9. Older age. 10. Smoking. 11. Family history of liver cancer. Complications. 1. Liver failure. As cancer progresses, it can impair liver function. 2. Metastasis. Cancer can spread to other parts of the body such as the lungs and bones. 3. Ascites. The buildup of fluid in the abdomen due to liver dysfunction. 4. Bleeding disorders. The liver produces clotting factors and liver cancer can lead to increased bleeding risk. 5. Portal hypertension. Increased pressure in the portal vein which can lead to vesical bleeding. Liver cancer develops due to mutations in the DNA of liver cells which cause them to grow uncontrollably and form a tumor. Chronic liver injury such as from hepatitis or alcohol leading to inflammation, cell death and regeneration. Which increases the chances of genetic mutations. Cirrhosis, often the result of chronic liver disease, creates a favorable environment for the transformation of hepatocytes into cancerous cells. The exact mechanisms include alterations in growth factors, immunosystem response, and angiogenesis. It's a form of new blood vessels that support tumor growth. The pathophysiology of liver cancer involves a sequence of cellular and molecular events that leads to the uncontrolled growth of malignant cells within the liver. Here is a step-by-step breakdown of the process. 1. Chronic liver injury. 2. Cirrhosis development. 3. Genetic mutations. 4. Uncontrolled cell proliferation. 5. Formation of tumor. Hepatocellular carcinoma. 6. Tumor angiogenesis. 7. Local inversion. 8. Metastasis. 9. Liver dysfunction. This sequence of events drives the development and progression of liver cancer. With chronic liver injury and genetic mutations being central to its pathogenesis. Signs and symptoms. Liver cancer often presents with non-specific symptoms in its early stages, making early detection challenging. Common signs and symptoms include 1. Unintended weight loss. 2. Loss of appetite. 3. Upper abdominal pain or discomfort. 4. Swelling. Bloating of the abdomen. 5. Jaundice. Yellowing of the skin and eyes. 6. Nausea and vomiting. 7. General fatigue or weakness. 8. Itchy skin. 9. White sulky stools. Diagnosis. 1. Physical examination, checking for liver enlargement or tenderness. 2. Blood test. Alpha fatoprotein AFP. Elevated levels of this protein can be a marker for liver cancer. Liver function test to assess liver health. 3. Imaging test. Ultrasound, CT scan and MRI. These help visualize liver tumors. Angiography to study the blood vessels in the liver. Biopsy. A sample of liver tissue is taken for histological analysis to confirm the cancer diagnosis. Nursing diagnosis: 1. Impaired liver function related to tumor inversion. 2. Acute or chronic pain related to liver tumor growth. 3. Risk for bleeding related to impaired liver synthesis of clotting factors. 4. Fatigue related to anemia or cancer progression. 5. Imbalanced nutrition less than body requirements related to anorexia, nausea and vomiting. 6. Anxiety and fear related to diagnosis and treatment. Management: 1. Monitoring regular blood test and imaging to monitor liver function and tumor growth. 2. Symptom management: pain management with medications, example opioids. Management of ascites with diuretics and parasyndosis. Nutritional support and hydration. 3. Psychosocial support, counseling, patient education and support group. Treatment: 1. Surgical options: liver resection, removal of part of the liver containing the tumor. Liver transplantation recommended for certain patients with early stage cancer. 2. Ablation therapy, radio frequency ablation, heat to destroy cancer cells, cryoablation, freezing to destroy cancer cells. 3. Embolization, transarterial hemoembolization, injects chemotherapy directly to the liver tumor and blocks blood supply to it. Radio embolization delivers radiation directly to the liver tumor. 4. Radiation therapy, use high energy radiation to target and destroy cancer cells. 5. Systemic therapy, A. Targeted therapy, drugs like sorafenib and lenvatinib target specific pathways involved in liver cancer growth. B. Immunotherapy, drugs like nivolumab help the immune system recognize and attack liver cancer cells. C. Chemotherapy, systemic chemotherapy is less effective but used in certain advanced cases. Psychosocial medicine. Patients diagnosed with liver cancer often experience emotional distress, anxiety, and depression. Psychosocial interventions such as counseling, therapy, and support groups are essential to address the mental and emotional well being of patients. Support from family, friends, and healthcare professionals can help patients cope with diagnosis, treatment, and its impact on their lives. Prevention. 1. Vaccination. Hepatitis B vaccine reduces the risk of chronic hepatitis B infection, a major risk factor for liver cancer. 2. Screening. Regular screening for those at high risk. Example, chronic hepatitis or cirrhosis. Using imaging and AFP blood test. Three lifestyle modifications. A. Avoid excessive alcohol consumption. B. Maintain a healthy weight to reduce the risk of NAFLD. C. Avoid aflatoxin exposure by storing food properly. D. Stop smoking. 4. Treat underlying liver diseases, prompt and appropriate management of hepatitis B or C can reduce the risk of cirrhosis and liver cancer. In conclusion, liver cancer is a serious and potentially life-threatening disease, but early detection and treatment can improve outcomes. Prevention efforts, particularly focusing on hepatitis B vaccines, managing hepatitis infections, and addressing lifestyle factors such as alcohol use and obesity are crucial in reducing the incidence of liver cancer. Multidisciplinary management involving surgery, ablation, embolization, and systemic therapies plays a central role in treating liver cancer, along with providing psychological and social support for patients. Thank you. Have a nice day.